Every man has this pea-sized gland known as the prostate gland, which is wrapped around the urethra. The prostate gland produces some fluid that is added to semen, and its muscles help to push semen through the urethra. Some conditions that affect the prostate are prostatitis, which is inflammation of the prostate gland, benign prostatic hyperplasia, which is also known as BPH, and it's an enlargement of the prostate gland. There's also prostate cancer, but today I will be talking about benign prostatic hyperplasia. It is a condition of the prostate that becomes more common with age, and as the name implies, it is benign, meaning it is neither cancerous nor a malignancy. Benign prostatic hyperplasia basically means an enlarged prostate, and it is the commonest prostate problems faced by men, as almost all men with prostate will develop some enlargement in the gland as they age. Research showed that at autopsy, 50 to 60% of men in their 60s had some form of enlargement of the prostate, even though did not show symptoms, and 80 to 90% of men in their 70s and above had similar enlargements seen. The cause of this enlargement is seen to arise due to a loss of homeostasis or balance between prostatic cellular proliferation and apoptosis, that is programmed cell death. The imbalance tends to favor cellular proliferation, which causes the enlargement of the gland. The cause is associated with a lot of risk factors as well as direct hormonal effects of testosterone on the gland. The direct effect of testosterone on the gland was seen because men who were castrated before puberty were seen not to develop BPH later in life, or men who have androgen-related disorders never come down with BPH. There are other risk factors associated with the development of BPH. Most importantly is age. It is seen in men older than 50 years. In the black population, it is said to be from 40 years and above. There's also the family history, where when a first degree relative has had BPH, there's also the likelihood of one coming down with it. There's also obesity, diabetes, lifestyle basically, such as lack of physical activity, excessive alcohol consumption, smoking, and eating high saturated fat diets. The symptoms associated with this condition is increased urinary frequency, that is having to void several times a day, sometimes more than 10 times in a day. Nocturia, having to wake up several times in the night to void. Urgency, that is once you are pressed, you're unable to hold your urine. Sometimes you even urinate before getting to the toilet. There's also straining on urination. You go to pee, you have to force it out to come out. There's also the hesitancy. When you go to pee, you wait a while before the stream starts coming out. There's the intermittency, so once the urine starts coming out, it stops halfway, then it continues and stops halfway. Terminal dribbling, where you see drops of urine still coming out after you are done urinating. There's the urinary incontinence, and sometimes they may not just present with these symptoms to the hospital. A patient may present as an emergency, that is having acute urinary retention, where it's so painful, the bladder is full, yet unable to void, and then there's the suprapubic swelling as a result of the fullness of the bladder. Once you start experiencing these symptoms, you should see a urologist. Examinations will be carried out, especially the digital rectal examination, which is going to reveal the state of the prostate, whether enlarged or not, whether fixed or not, and other investigations which will help to make a diagnosis and propose a treatment plan. The treatment depends on the presentation of the patient, whether the patient presents with acute urinary retention or the patient presents with the symptoms we mentioned earlier. So if the patient presents with acute urinary retention, a Foley catheter will be passed for urine drainage and to relieve discomfort before any other thing is done for the patient. Now, the treatment of this can either be medical or surgical. The medical treatment entails the use of drugs that can relax the prostate and the bladder, or drugs that inhibit the production of testosterone, since we mentioned earlier that testosterone is directly implicated in the enlargement of the prostate gland. Surgical treatment is reserved for patients who do not respond to medical therapy, and a resection of the prostate gland is done. There are several means for prostatic resection. It can be transurethral, it can be transabdominal, it can be transrectal. The moment the symptoms are noticed, a quick visit to the doctor is advised for prompt treatment and intervention.